Hello, it's Lara Hockman, the medical matchmaker here. Today I wanted to talk a little bit about salary and how they relate to the hours that you're working. And forget work-life balance, that's for sissies, right? That's for non-physicians. So, yes, I'm kidding. Okay, so I'm going to take an example of a pediatrics practice that I'm working with right now and the pediatrician candidates that I've been speaking with, the pediatricians that are interested in the position and kind of their thinking. And I'm going to share my screen here. And while I do that, I'm going to tell you that if you have something to say about pediatricians getting paid more, you're absolutely right. And let's take it up with the insurance companies. If anyone wants to fight that fight with me, let's do it. Okay, so the pediatricians were saying that they have been offered about $170,000 for 36 hours a week, which equals about $90 an hour, right? Now, what these pediatricians have to see many patients to reach this dollar amount because this is after their productivity bonus. So before the productivity bonus, of course, this was a lower base salary and then it gets brought up. So that's $90 an hour. Now, if you really think about it, they're spending 36 hours with patients. We all know that the salary does not include the after hours charting, the after hours lab work, and all of that. So just say they spend 2 hours a day on all this extra stuff. That ends up being 2, 4, 6, 8, 10. So about 46 hours a week. Let's see, how do I erase that? So 46 hours a week times 52 weeks a year equals 2,392. Okay, so what you're actually getting paid here divided by 2,392. So you're actually getting paid $71 an hour. And that's if you spend 2 hours a day charting. Okay. Now let's look at the private practices that I work with that typically have something like a scribe or really robust templates so that when you're done at the end of the day, maybe you have 5, 10, 15 minutes, maybe 30 minutes to just finish up, and then you're done. So let's see. So they're offering, depends on the practice, let's say 160,000 for full time. That would be divided by 36 hours for 52 weeks a year, and that's $85 per hour. So it sounds like less per hour, but when you're done, you're done. And so it ends up being more. So really, when you're looking at a position, you want to ask the physicians in the practice, how long after hours are they spending charting? Because that's a huge deal. Not only does it have anything to do with, time with family and time with kids and just having a life outside of work, which is so important for burnout, but it also, you may be surprised that you potentially are actually earning more per hour, even though you're earning less. So, this comes up with direct primary care, it comes up with private practices, but really dig deep into what you're being offered by hours. And a part of that is asking the doctors who already work in the practice. I have awesome practices. They absolutely care about their physicians. They're human beings, and the discussions that I have with them are so wonderful, and they're all about supporting their physicians. My stories are endless. I love the private practices that I work with. They are human beings. They bring the human into negotiating, and if you're interested in hearing about them, please do reach out. And of course, if this was helpful, please like, comment, share. I think there's a lot of people that can benefit from this. So, bye.